Hello, Brad here from 999 KnowHow. In this video, I'll be covering essential basic airway management techniques, focusing on simple maneuvers and the use of airway adjuncts. Just a quick reminder, this content is for educational purposes only, so always check and follow any local protocols and procedures. So, let's get started. The first step in airway management is to keep the airway open. Let's start with basic techniques. Head tilt, chin lift. This maneuver opens the airway by extending the neck, pulling the tongue away from the back of the throat. Jaw thrust is used if a neck injury is suspected. This technique keeps the airway open but without moving the spine. Both maneuvers help ensure the patient has a clear path for air to enter the lungs. When a patient is unconscious but breathing, the recovery position is a simple but effective maneuver. Place the patient on their side with the head slightly tilted back. This allows for any fluid to drain out, preventing an airway obstruction. Next, let's talk about airway adjuncts. The oral pharyngeal airway, or OPA, keeps the airway open by preventing the tongue from blocking it. Measure from the patient's earlobe to the corner of the mouth to find the correct size. Insert the curved side facing to the roof of the mouth, then rotate it as you advance it. This positioning helps secure it safely. For semi-conscious patients, a nasal pharyngeal airway, or NPA, is often more suitable. Measure from the tip of the nose to the earlobe for the correct length. Lubricate the NPA, then insert it into the nostril, with the bevel facing the septum. This route is less likely to trigger a gag reflex. Remember, always monitor the patient after placing an adjunct, as they may require adjustment or removal. Now let's go over some essential airway management terms. Patent airway. This means the airway is open and unobstructed, allowing air to pass freely. Obstructed airway, when something like the tongue or foreign object blocks the airway, preventing effective breathing. Airway adjunct are devices like OPAs and MPAs that help maintain a clear airway by preventing obstruction. Oral pharyngeal airway, OPA, a curved device inserted through the mouth to prevent the tongue from blocking the airway in unconscious patients. Nasal pharyngeal airway, NPA, a soft tube inserted through the nose to keep the airway open, typically used in semi-conscious patients. Aspiration, which is inhaling foreign material such as saliva or stomach contents, which can block the airway and cause complications. Let's go through a quick scenario. Imagine arriving at the scene where a patient is unconscious and showing signs of an obstructed airway. After performing the primary survey, you notice they're not breathing adequately. Start with a basic head tilt chin lift to see if this opens the airway. If there's no response or improvement, try inserting an OPA and monitor their breathing closely. Using these steps in sequence can make a crucial difference in an emergency and help maintain an adequate airway. Let's recap the key techniques. Head tilt chin lift and jaw thrust are used to open the airway. The recovery position is used for unconscious but breathing patients. Use OPAs and MPAs when necessary, making sure to size and insert them correctly. Thanks for watching. I hope this short video on basic airway skills has helped. Remember to like, subscribe and follow us on social media for more FREC4 content.